Uneven veneers. Replacement veneers are something we see a lot of. And when patients have existing veneers they've had done elsewhere, often we ask them why they're replacing them, and it's usually down to either the bite or the appearance. In this case, we have a situation where the bite was actually okay, but it was the appearance. And we want to ensure that the patient suffers no failure in future in terms of the bite and the appearance when we deliver the replacements. So we like to do things using the 3-step process of the handmade trial smile, reviewing that with the patient, confirming the design, and then copying that to the final. That's our smile sculpting technique, and that's how we avoid those common issues. Now, if I take this case and I show you why she's having her veneers replaced, let me show you this case. This is my patient who's got existing veneers, and these are on this tooth, this tooth, this tooth, this tooth, this tooth, to this tooth. So she's got her 6 upper teeth improved. Now, what she doesn't like are a fair few things about them. She doesn't like how triangular the teeth are in terms of shape and how short the front 2 teeth look at the top. She also doesn't quite like the appearance of the porcelain. It looks a little bit flat. The ceramic should have a little more natural element if that's what we're aiming for. And here we have a situation where it just looks like dentistry rather than natural teeth. And we have a certain number of teeth treated that have increased the dominance of those front 6 teeth. We also have edges that are a little bit on the uneven side, and those are things we wanted to improve. So the first step for me in these cases is to remove the existing restorations and remove the existing veneers and place a handmade trial smile that I'll smile sculpt myself by hand to ensure that I'm eradicating all of these issues. Now, what I also did for this patient is I adjusted her gum level and her gum line here using a laser. So it's painless and it's instant healing to kind of give the proportions a little bit of an improvement. So let me show you the handmade trial smile for this case. And you can already see that actually things look a lot more even. We've got a good lip position in relation to the upper edges of the teeth, and that's flowing quite nicely. The profile is nice and flat, and we're already seeing an improvement in gum shape. If I look from the front, her upper 2 central incisors, this tooth and this tooth, no longer look extremely short and are much more evened out on the edges. Overall, we've also widened the smile slightly, where we've got 2 additional veneers here and here. Now, this is smile sculpting. This is a temporary, which I've made fully by hand to determine the shapes, the size, the character that we would like. We then approved it with the patient. She liked the temporaries, and we created the final porcelain veneers. Now, these final veneers are not fitted on the teeth, they're just sitting on top of the teeth. And I want to show you the difference between the finals and the handmade temporaries. In terms of shape, there is little to no difference whatsoever. The final porcelain looks much more natural, with natural effect and more gloss and shine. The temporaries are a little more matted and a little more stained because they've been there for a little while. This verification photo is extremely critical because this is how we can demonstrate that the final and the temporaries are a good copy of each other. A lot of time and effort has gone in over the years to develop techniques where we can actually do this predictably. So when we say to a patient their trial smile is what they've approved, we know that the final result is going to mimic that in every way that it possibly can. The final result, we went for 8 porcelain veneers, so 2 additional ones and replacement on the others. So from here to here, we have the replacements, and here we have the additional. What you'll see is the contour of these teeth is not totally flat, not totally flat in terms of the shape. We have nice reflective contours. The other thing we have is horizontal texture, and we have some effect in the porcelain, and this just mimics nature. The gum levels also look much, much healthier, and this is on the day of fit, hence a little bit of bleeding, but this result is now going to look very, very natural and very, very, very aesthetic for a long, long period of time because the material does not stain, very rarely, if ever, chips, and will not change color. And that's why this case has been a real success, and the patient is obviously had a life change by changing the veneers over.